Hello, everyone. I'm delighted to talk to you about a new development in obstetrics, quite exciting development, which is the use of handheld ultrasound. There are many uses for handheld ultrasound in obstetrics, starting from the viability to the pregnancy dating to determining whether it's singleton or multiple pregnancy, to the placenta location, ruling out placenta previa, fetal presentation, also the fetal position prior to instrumental delivery, the abnormalities of the amniotic fluid volume, and also, of course, diagnosing whether the fetus has a structural abnormality. The easy access to the handheld ultrasound devices and their cheaper cost, and the fact that it's easy to use makes them very attractive to be implemented in low and middle income countries and in community practice. As the technology has improved over the years, the quality of the ultrasound images we obtain using handheld ultrasound devices is getting close to the quality of the ultrasound images that we get using the high-end ultrasound systems. And in fact, all these ultrasound images that you can see in front of you are actually obtained using a handheld ultrasound device. It's not just the ultrasound images, but also ultrasound clips, and all these ultrasound clips that you can see demonstrating the heart or the kidneys or the lips, the profile, or the umbilical cord insertions are obtained using handheld ultrasound device. And in fact, last week, I managed to perform the entire anomaly scan using handheld ultrasound device. The question is whether these handheld ultrasound devices are comparable to the high-end ultrasound systems. And this question was addressed in this systematic review, which included a large number of studies. 4 of them focused on obstetrics, and the conclusions of these studies and of the entire systematic review that these devices tend to be comparable to the high-end ultrasound systems. They are a valuable supplement to our physical examination, and they have the potential to become a complementary and easy access to diagnostic tool in obstetric patients. I'm going to spend the next few minutes focusing on fetal presentation. And it is true that assessment of fetal presentation is particularly important at term. However, it's also important, particularly for a woman who presents from preterm labor or premature rupture of membranes. In the UK, where I practice, the low-risk pregnancies are offered 2 routine ultrasound scans. The first one, the first trimester ultrasound scan, which is scheduled between 11 and 14 weeks, and the second trimester scan, or the anomaly scan, which is scheduled between 18 and 22 weeks. And in a very small number of hospitals in the UK, probably less than 10, including where I work, St. George's Hospital, we do offer routine third trimester ultrasound scan at approximately 36 weeks, but that's not offered in the majority of hospitals, maternity hospitals in the UK. About 3 to 4% of babies are present or have breech presentation. And you can see the incidence of breech presentation varies with gestational age. Tend to be more common earlier than later. The problem with breech presentation that's associated with excess perinatal mortality and morbidity, and is also associated with has medical legal implications. And just to give you an example, so this was a case that the woman presented in undiagnosed breech in labor, and unfortunately the baby suffers hypoxic ischemic encephalopathy secondary to intrapartum complication. And this case, the cost of this case was 37 million pounds, so very expensive, and that was literally last year, July 2020. According to the Royal College of Obstetricians and Gynecologists guidance, once we make a diagnosis of antenatal breech presentation, near term, that we should offer detailed discussion with the pregnant woman about the options, which are 3 options: either external cephalic version or ECV, or planned cesarean section or planned vaginal breech birth. However, it's also important to highlight that 30 to 50%, to nearly half of the babies presenting with breech are only detected when the mother presents in labor, and therefore there are only 2 options: either emergency cesarean section or unexpected vaginal breech delivery. Both options have maternal and infant risks. And therefore, what about offering universal late pregnancy ultrasound? And in fact, this study, which was in Cambridge in the United Kingdom, concluded that universal late pregnancy ultrasound eliminates undiagnosed breech presentation in labor and therefore reduces the risk of perinatal mortality and morbidity. And it's estimated that it saves at least 7 babies' lives a year across the United Kingdom. And of course, that means we can offer informed maternal choice of mode of delivery to the pregnant woman. And I did mention that this study sort of demonstrated that the universal late pregnancy ultrasound eliminates undiagnosed breech presentation in labor. However, just to maybe mention here that as I highlighted earlier, where I practice at St. George's, we do offer routine third trimester scan at 36 weeks. And certainly in the last 12 to 18 months, I came across 3 pregnant women who had cephalic presentation at the 36 to 37 weeks ultrasound scan, but they actually presented with breech in labor. And in fact, the most recent case was literally a few days ago, where Brimey Gravitt, so first pregnancy with cephalic presentation at the 36 weeks ultrasound scan. And when she came at 38 weeks, the baby was in breech presentation. What about cost effectiveness? Well, it's again, according to the UK figures, the universal late third trimester ultrasound scan would be cost effective if the cost is less than £20. However, the national tariff ultrasound scan by a sonographer in the United Kingdom is just under £50, and therefore actually doing a third trimester ultrasound scan is not cost effective. However, if we are able to offer or to offer this routine fetal presentation ultrasound during the routine antenatal visit by the healthcare professionals who are actually conducting this routine visit, so the midwives or the doctors, and if we use a low-cost handheld device rather than the high-end ultrasound systems, that means that it is potentially that we would be able to meet the threshold for cost efficiency, which is less than £20, and also being able to offer easy practical implementation. And therefore, if we are able to train the healthcare professionals to provide the presentation scan, as I mentioned earlier, would reduce the risk of undiagnosed breech in labor, and therefore reduce the risk of emergency cesarean section, reduce the risk of perinatal mortality and morbidities. That's the clinical outcomes, but also from the service point of view, increase the speed of access to ultrasound. The woman does not have to wait or to go to the hospital, reduce the waiting times and anxiety, and reduce the sonographer's workload, which is important particularly in healthcare systems or countries where there is a shortage of sonographers. How does it work in practice? So this video will show you the midwife performing abdominal palpation and then doing the ultrasound, handheld ultrasound for fetal presentation.
Hello, how do you pronounce it? Chiara. It's Chiara. Chiara. Okay, Chiara. I'm Shalone. I'm just going to have a feel of your tummy and see how your baby's doing. We want to see if we can find out how baby's lying today.
Okay, that's fine, thank you.
Okay. Which position your baby's in? And where do you feel most of the kicks?
I feel most of the kicks on the left hand side.
That's always an oh yes. It feels like there's a foot up there. Okay. Okay, I'm going to have a little feel down in your pelvis. Take a nice deep breath. And out. Lovely. Good. So I think that's your baby's head down there. So we're going to just confirm it using our new little handheld scanner.
Okay.
Lovely. Right, if we, yes. Lovely. So what did you? Yeah, beautiful. Lovely little head. And then let's follow the baby around a bit, so we can get your little face image. Very nice, clear image of the baby's head. Thank you.
Recently in the United Kingdom, the National Screening Committee reviewed the initial evidence of the third trimester breech presentation scan, and certainly the comment was the fact that it looks promising and maybe a suitable candidate for a screening program once we have more evidence. And this was highlighted in this document, which is published by the government on the safety of maternity services in England, that was published literally a few months ago. What about in obstetric emergencies? We did this very simple experiment where we actually calculated the time that is taken to turn on the ultrasound system. So on our labor ward, which we use the GEP8, and the time that to plug in and turn on the machine, that was just under 2 minutes, 20 seconds. And we repeated the same experiments using the handheld ultrasound, and it took us just under 35 seconds, so much shorter time, which is obviously important in an obstetric emergency. It's really important to highlight the fact that we need to ensure training and competency, and we developed this training program. So that starts with online training, and once that's completed, you have practical or hands-on one-day training and theoretical assessment, and then you have a training logbook, and you once you complete the training, you have a practical assessment, and if you pass that, you get your certification. If you ask me what the future of our medical practice, how that going to look like, my prediction would be the fact that digital technology or digital innovation will have more integral part of our everyday medical practice. I think it's likely that a lot of the services that we offer at the hospital or in the clinics are going to be offered remotely or in the community, and therefore less women have to come to the hospital or the clinics. And we've seen some of that already during the COVID pandemic. So really my conclusions is that handheld ultrasound can provide almost all aspects of basic obstetric ultrasound scan, and particularly important and many advantage in low and middle income countries and in community setting. And I showed you that it's provide a faster access to ultrasound in obstetric emergencies. Certainly it can provide many training opportunities and remove some of the challenges to train the doctors and allied healthcare professionals, including midwives. And as I reiterated, the importance of ensuring adequate training and competency and developing protocols using handheld ultrasound devices. And I'm just going to end this talk with the views of our users. So that's a pregnant mother and a consultant midwife on the use of handheld ultrasound.
Hi, welcome. Can you tell us, please, what is your opinion as a pregnant woman of handheld ultrasound?
Hi. So I have to say, as a pregnant woman, as a mom, it was a very nice experience because I was not really expecting it. I just went to my normal midwife appointment, and the midwife just wanted to confirm the position of the baby, and then she took out from her pocket this handheld device, and I was not really expecting it because I was like thinking, oh my god, I need to go back to the hospital. I don't want to go all the way down there, you know, especially now with COVID, and I didn't want to be exposed twice. So when she took it out of her pocket, I was happily surprised. And then I have to say that you're expecting like a huge machine, but this one was very, very small, so it didn't scare me that much, and it was still easy to see, to look at the baby. And actually, it was nice to have like an extra opportunity to have a look at him. And also it was nice because myself, I was not 100% sure of the position. Like, she told me that the back is here and then the head is down, whereas up to now I was thinking the head was up here, so I was actually talking to the mom of my baby. So yeah, I would say it was really nice. I would recommend it to other pregnant women, yes. And then also, I think it would be nice, if possible, to offer it to all pregnant women at each appointment from maybe a certain time on, because I assume when the baby is too small, you can't really see much with that one. But maybe from, I don't know, a certain time, it would be nice to see baby position, also just to see the baby. I think it would be nice.
So using a handheld ultrasound device in the community could be quite beneficial for women and the midwives. It could help us to avoid unnecessary admissions just for a routine presentation scan. It could also reduce the time and the effort the women have to spend travelling and getting to different departments, particularly in busy areas of London where parking and the practicalities of getting to a hospital sometimes just for a fairly basic scan can be quite challenging. So the training of midwives in the community would involve a significant amount of theory and practice. This could be done within the unit or maybe in the community if we have a community midwife who can supervise you. Also in the ultrasound department, if you have time to come to use a scanning device or a normal sonography machine, because getting used to just the visual aspects of the scan picture is something that midwives will have to get used to. So being 99% sure of the presenting part is not good enough as a midwife. We need to be 100% sure of the presenting part, particularly over 36 weeks of pregnancy.
I'm going to stop here and I'm happy to take any questions. Thank you very much for your attention.